You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, biohacking, and sports performance. Stay up to date and listen anywhere and anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your host, Dr. Justin Marchegiani, as he answers your burning health questions as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Hey there, it's Dr. Justin Marchegiani. Welcome to Beyond Wellness Radio. Feel free and head over to beyondwellnessradio.com where you can access our full podcast transcriptions. While you're there, you can also sign up for our thyroid and female hormone video series. This series goes into the root cause of why your hormones are out of balance. While you're there, you can also schedule a functional medicine consult with Dr. Justin, myself, where we'll dig deeper into the root cause of your health challenges. Feel free and think of sharing this podcast with at least one person. This podcast grows by people sharing it. Sharing is caring. If you can think of one person that can benefit from this information, please feel free and share it. If you're enjoying the podcast, make sure you subscribe on iTunes. You can also click below the video or podcast where you'll see the iTunes review button and leave us a review. You can also sign up for the newsletter at beyondwellnessradio.com where you'll get updates before anyone else. Thank you so much and enjoy the show. Hey there, it's Dr. Justin Marchegiani. Welcome back to Beyond Wellness Radio. Today we have a functional medicine practitioner. Her name is Torea Rodriguez. You're out of Santa Cruz, right, Torea?
Yeah, Santa Cruz is it.
Awesome. And you're an autoimmune specialist, correct?
I am. I do functional medicine specializing in autoimmune. That's how I got started. I got sick with autoimmune Hashimoto's, and it's what I'm most comfortable with, and it's what I understand the most. So that's what I focus on.
What an epidemic autoimmune conditions are today, huh?
Absolutely. I was reading in the Autoimmune Fix, Tom O'Brien's new book. Mm-hmm. And he was explaining that, most autoimmune diseases, what we know now is that it's more of an autoimmune spectrum as opposed to a specific disease. And so while there's over 135 classified autoimmune diseases, it's probably even more now. And that all of those are just what's known to us right now. Like there could be so many other ones. And so it's really the spectrum effect that happens. And yeah, it's really prevalent.
Yeah, it's really interesting because with autoimmune conditions, if you really look at what the conventional medical establishment has to offer, it's not too much. They have your immunosuppressive medications, corticosteroids like prednisone. There's not really even a diet shift or diet modality when it comes to autoimmune conditions, even though we know the research and the literature is so rich with that type of information. And also the whole idea of leaky gut really isn't even talked about it. What's your take on the conventional approach medicine offers, mainstream medicine for autoimmunity?
I think that they are in a very unfortunate situation, to be honest. They're behind in terms of research. There's not one doctor that I know. You tell me if I'm wrong, but there's not one doctor that I know that has the time in between their 15-minute consults to also go and read the PubMed and the medical literature to stay up on what's going on. So I think they're in a very unfortunate situation. And then the other part about the traditional medical establishment is that they're focused on special areas. So we've got the cardiologist for the heart health, and we've got the endocrinologist for, the endocrine system and the different hormone systems and all of those different things. And they're looking at it from a very specific point of view from that organ, if you will, when really autoimmunity needs to be that 30,000 foot view, big picture view, because it's the entire immune system. It's the entire body that is having a problem. So yeah, I think that it's just, they're in an unfortunate situation.
100%. I see that every day. It's like, unless you have a clinical framework in which you operate in, you could skim through articles, but it may not mean much to you because where do you plug that clinical piece of information into how you treat patients? Because typically it's 3 to 5 minute consult, right? With the patient, you have a prescription pad. For the most part, you're looking for a diagnostic code that justifies, you to make money off the patient because they are a business. And then typically that involves a prescription, right? Or some type of procedure for the most part. And that's it. It's really about managing that condition And the whole idea about addressing it or fixing a root causal issue really isn't even there. I mean, it's amazing that people can go to physicians where their goal really is just how can we prevent the symptoms from getting worse down the road versus let's fix this.
Yes.
Totally different mindset.
Completely different mindset. And that was my exact experience when I was diagnosed with Hashimoto's back in 2009. And I started working with an endocrinologist because that's where people go who have thyroid issues. They go to an endocrinologist and start working with them. And, he prescribed me medication after medication and it's not working and I can't get my labs stable and it's still not working. So we'd switch it or we'd double the dose or, we kind of got to a point where I challenged him because at the time I needed to pass an aviation medical. And I challenged him. I'm like, look, I need to pass this exam in a month. We've got a month. What do you got for me? Like, we got to do this. Otherwise, I have to stop flying for a living. And he just kind of put his hands up and he was kind of like, well, the next thing I know to do is to irradiate the thyroid and cut out the rest of the tissue. And I was just like, whoa, brakes on. Full. Like, that's not the path that I want to go down.
Right.
And that was the real foray for me to start looking into functional medicine and to start looking at alternative solutions because I knew that there was something else going on. It wasn't just the thyroid. I mean, there's countless people out there with thyroid issues and they feel fine. So what is going on? And I wanted different answers.
That's great. This is a great segue into kind of let the listeners know a little bit more about you. And most people, they kind of walk that, most practitioners or physicians, they walk the journey of the wounded healer, right? They have some type of health ailment themselves. They bump their head against the wall a few times, that wall being conventional medicine, and then was able to find a path that actually worked, that really was focused on root causal health information. So why don't you share your story? I know you mentioned you were a pilot. I think you also have a biochemistry background, right?
Yeah. My undergrad degree is in biochemistry and, and I worked in the technology industry. So I've kind of bounced around careers a little bit, but, at the time I was a professional pilot, I wasn't feeling good. I mean, I knew something was wrong. And when it came time to really decide, am I going to go under the knife to try and fix this? Or am I going to try and find alternative solutions? I really knew in my heart of hearts that I needed to find an alternative solution.
And by under the knife, you mean getting your thyroid removed, right?
Yeah. I mean, he wanted to give me irradiated iodine and then cut out the rest of the tissue. And I did not want to have surgery, to be honest. I just did not.
So it sounds like you were diagnosed with Graves'. Is that what happened? Or was it something else?
Hashimoto's.
So this was
Hashimoto's. Yeah. And most, for listeners who don't know, usually you take out the thyroid when it's Graves', which is the opposite, the hyperthyroid situation. And he just didn't know where else to turn. These were the tools that he had. And that's why I have so much compassion for them, is that they have the tools that are in their toolbox and they're not necessarily applicable to the types of diseases that we're seeing right now.
It totally makes sense. And that makes sense too, because Hashimoto's in the early stages can seem like Graves' because the antibodies are different. They're not the same kind of antibodies. One's thyroid stimulating immunoglobulin and the TSH receptor antibodies. The one for Hashi's is TPO and thyroglobulin. So different effect, but in the early inflammation response, the thyroid hormone spills out and can create that hyper kind of symptom. So that makes sense.
Yeah, absolutely. So I started searching for anybody that knew anything about thyroid and natural healing. And I had stumbled across Chris Kresser's writings. And this was back early in the day when he was just writing about stuff. And he said something that really clicked with me, which was that we're dealing with autoimmunity and we're dealing with a disease of the immune system, not a disease of the thyroid, not a disease of the myelin sheath of your nerves. It's a disease of the immune system, and that we need to really focus on the immune system itself. And that just lit a light bulb. It was an epiphany moment. It's like, of course, that makes total sense. So let's go down that path. So I pretty much didn't know where he was, didn't care, was going to get on any plane to go see him, begged myself into his clinic, and he took me on as a client. And that's when I really started to understand the multiple layers that had come into play to cause me to get sick and the work that I needed to do to start healing. Yeah.
Very cool. So with your working with Chris, I mean, I know he's kind of a paleo template guy. I'm a big fan of a paleo template, right? We kind of can adjust the macronutrients and dial things in according to what works best for you, the patient. Just curious if you could lay out just you and your experience as the patient and what worked best for you. What are those top 3 things that really were game changers in your case?
I think the very first game changer was taking a different perspective on my diet. I had always felt that I was healthy and that I was eating very healthfully. And to stay healthy on the road, I was keeping to a vegetarian diet with a lot of healthy whole grains, right? And so taking a different perspective and really taking a look at what it was that I was eating and what, more importantly, what I was missing in the diet. There were a lot of nutrients in my diet that were missing from that. And so switching to a whole food paleo type template was exactly what my body needed at the time. And I would say that that in itself gave me a huge boost and a huge stair step of healing right away.
So you were eating a lot of grains back then, and were you eating any meat as well?
I was not.
Wow.
I was trying to stay healthy on the road, so I was staying vegetarian because, of course, you're eating out all the time.
Got it.
So I was just like, oh, I'll just stay vegetarian. That'll keep me healthy. And then, in hindsight, looking back, the other time I experimented with being vegetarian was in college, and I got very, very sick in college. And I know now that for me and my body type, I need to include animal proteins in there. That's the only way I feel really great. So yeah, so I would say food was the other thing, and then rest. Not really rest. How should I say this? I had to take a very serious look at my type A hyper overachiever lifestyle.
Right.
And that was really, really hard to do as a pilot. You are used to achieving every 6 months and passing check rides and switching to the next airplane and all of those things. And that was something that was really driving my nervous system into sympathetic fight or flight all the time. And I had pretty much activated it all the time. And I really had to take a serious look at that. So that was one of the other things that was really, really key in healing, but expressly difficult to adjust to.
So you sounds like you had some adrenal dysfunction there too?
Oh, yeah. They were pretty much the way Chris put it. And I don't know if he was trying to scare me or not, but he basically said, you are one step away from Addison's disease. You need to do something different.
And were those initial tests that you ran for adrenals, were those on the BioHealth 201 adrenal panel?
Correct.
Okay, cool.
Yeah.
Do you remember what your total cortisol
panel
was?
I think it was like 12.
Wow, that's so low.
Yeah.
How about your DHEA?
I don't even remember. I'd have to go take a look. But yeah, I mean, it was pretty much tapped out. I mean, I was tapped out. I was sleeping 14 hours a night and feeling like I was hit by a Mack truck the next morning. Like I was not feeling rested ever.
And so recapping, you were eating a vegetarian diet. So I typically hear that. I think low protein. I think probably excessive carbohydrate, probably lots of anti-nutrients.
It was all carbohydrate because in addition to flying, the other thing that I loved to do was long distance cycling.
Right. Oh yeah. There you go. So that you're carb loading, right?
Pretty much sugar all day long, every day.
How about fat consumption? Were you doing pretty low fat consumption?
Were
you doing a lot of nuts back then? Yeah.
Yeah. Nuts and, a little bit of olive oil here and there.
Yeah.
But butter was not in the profile at all. So I was very fat phobic at that point.
So we had blood sugar issues. We had nutrient density issues. We probably had a lot of anti-nutrient issues, adrenal dysfunction, and then autoimmunity, which probably was exacerbated by all of the grains that you were consuming too.
Oh, yeah. Wow. Most definitely. And there was pretty extreme iron anemia that we discovered, and which explained a lot of the issues that I was having. I was getting hypoxic at very low altitudes at work. And hypoxia is the term for when you are lacking oxygen at altitude. And usually you'll feel hypoxic anywhere between 8,000 and 12,000 feet. Everybody's a little bit different.
Yeah.
But I was feeling very hypoxic at 5,000.
Wow.
And the cabins are pressurized at 8,000. So I was even more fatigued at the end of my shift because I was constantly, quote unquote, at altitude all day long and getting really sick from it.
And so you were an airline pilot. Were you like flying like major airlines or
No, I flew charter and
charter?
corporate aviation. Yep.
Got it. Now, I'm not sure if this is true, but I've heard that pilots aren't able to fly while consuming aspartame. Is that true?
I would have to double check what the regulations are with the FAA, but
Okay.
at the time when I was flying, aspartame was fine.
It was fine. Okay. I
Yeah,
wonder
it
if that's
wasn't a
something
regulated substance, but I'd have to check. That's curious.
Okay. All right. Very cool. And then let's dive in. There's one piece of your autoimmune puzzle that I think may have been an issue, but you didn't allude to it yet. You didn't mention anything about infections. Were infections a piece of the puzzle for you getting your thyroid and your autoimmune situation under control?
They were definitely a piece of the puzzle, but they came later. Like
Ah,
we really started with diet, lifestyle stuff
yeah,
first.
yeah,
Started focusing on healing the gut a little bit, and
yeah,
then also the adrenals. Like I was just
yeah,
so tapped out, right? Getting some
totally.
support there. But later on, we started to find GI pathogens for sure. And I tested positive for H. pylori, and then later on tested positive for another one that I can't even remember the name of it. And, as we started to treat those and heal those, we'd kind of talk about lingering symptoms, like what's left, what else is going on,
Right.
and sure enough, we found Giardia, but it took
Wow.
a number of tests and a number of passes at that for it to finally reveal itself. And that Giardia I'd had it for so long that it had left the intestinal tract and actually had gone into the gallbladder. And
Yep.
so I had all these crazy gallbladder attacks that I couldn't explain and ultrasounds to make sure it's not stones. And like it was kind of a little bit of a crazy path, but we finally found the Giardia and treated myself for Giardia. And that was another huge stair step, is to finally get rid of that pathogen.
So 3 major parasitic infections: H. pylori, something in between. Was it blasto?
Uh,
Blastocyst
no, it
hominis or
wasn't
crypto?
blasto. My husband's had blasto. It was crypto.
Crypto.
Yep.
Okay.
Yep. Yeah. Yeah.
Wow, that is nasty. Yeah, that's blasto crypt. I call that the Three Amigos, by the way.
Yeah. Definitely felt like the three amigos were having a party. That's for sure.
Right? Now, when you went to go attack the Giardia, did you have to do a gallbladder flush to get the Giardia flushed out?
I didn't.
Okay.
Actually, I was pretty lucky with the
Hmm.
anti pathogens that we
Okay.
used. Actually, it turned out to be fine. But
Got
yeah.
it. So we have adrenal issues, and that your situation. I mean, it's kind of unique in how it unfolds and what stressors happen in your life, but how things break down is pretty consistent, right? There's some
Oh,
level
yeah.
of dietary stress, and that's unique for each person, right?
Yeah.
Um, whether it's vegetarian side, whether it's the standard American diet and lots of conventional meat and grains, you have the adrenal stressors, right? You have imbalanced amount of macronutrients, so I call that blood sugar stressors. You have infections, and then you have the whole immune system all revved up
Yeah.
because of everything else, because all of the things I already mentioned. I see that
Yeah.
with most
And
patients.
there's another thing in there that kind of added to the whole perfect storm, which is what I now call acute stress events.
Mm.
There was a period of time between 2008 and 2009 when I was being diagnosed where I had lost a parent suddenly.
Wow.
I had gotten into a cycling accident, had pretty severe physical injuries, and I had an emergency at altitude and was the only pilot on board to deal with that emergency. So there was a huge amount of adrenaline that got pumped out that day when I was dealing with that actual emergency. And those three things all happened within months of each other.
Wow.
And that was pretty much a perfect storm on the stress side of things to completely cause additional leaky gut and cause additional food sensitivities and everything else that just kind of added to the whole picture.
Yeah, you really hit a point there that I want to emphasize. You talked about the leaky gut and the food sensitivities, and I think a lot of people at home, they hear stress, but they don't really think about how stress really impacts our digestion or impacts our gut lining. Because the
Oh,
biggest
yeah.
thing that really revs up this autoimmune cycle is stress and what it does to the gut lining, and then what that does to undigested food particles, and then what that does to the immune system as they slip through the tight junction to get into the bloodstream.
Yeah, absolutely. And, people hear stress, stress, stress. Yeah, yeah,
Yeah.
yeah, I get it. But what they don't understand is that in the lab, and I think this was Dr. Fasano's work,
Yeah.
is that in the lab, one of the ways that they would introduce leaky gut is hitting these poor rats over the head and causing head trauma.
Mm.
And that's a physical injury that resulted in leaky gut. So when we have a lot of stress, whether it's physical injury or not, that will cause leaky gut.
And is that mechanism through the head trauma? Is that through decreased activation of the vagal nerve?
That's my guess.
Yeah, that's
That
what I
is
think too.
definitely my guess. Yeah, vagal nerve is so huge in recovery and, stimulating the parasympathetic side of the immune system and nervous system.
Yeah, I was reading an interesting study just last week on petting animals and it's stimulating the vagal nerve. So I mean,
Really? I definitely need a dog again.
I know. I practice next to my dog Butter all day, so I pet her. I'm like, yeah, I'm getting my vagus nerve going. I'm practicing what I preach
Excellent.
here. Yeah. So nice
Yeah.
little fun fact there. Very cool.
Yeah, I look for all sorts of different ways to stimulate vagus nerve when trying to heal autoimmunity, because so many of us get kind of stuck in this cycle of the sympathetic side of the nervous system, and it's very hard to start to retrain the body to start activating the parasympathetic side. So I'm always looking for tips like that.
Yeah, that's good. And now, because you've had this history and you've been able to effectively treat it, which is great, what are you seeing in your patients? Are you seeing similar type of events kind of cascading, or what kind of infections are you seeing too?
Yeah, so lots of GI pathogens. I've seen the gamut of them. I'm also seeing patients who are attributing some of their getting sick, like how I had that perfect storm of stress events, to receiving tetanus vaccines,
Right.
right? Vaccinations.
Yep.
Or, some other kind of trauma. Usually it's a trauma that kind of starts the whole ball of wax to unravel. And so I see that quite a bit. So I pretty much apply the same technique, is to let's get an understanding of what's going on. Let's look for some of those co-infections and start dealing with those, so that I pretty much equate it to the immune system is pretty much overloaded at this point. It can't really deal with these things effectively. So we have to help it to get rid of those things so it can become stronger to be able to keep these things at bay. So it's, yeah.
Yeah, I totally see that as well, where like the immune system's compromised. It can't quite get rid of the infection on its own, and it needs just a little bit more help with whether a specific protocol that you create to help kind of knock that infection out, right?
Yep, absolutely.
And then you said something about 5 minutes ago. I want to kind of come back to it because I think just through the lens of the patient right now, if I'm a patient talking to you, the biggest thing I see patients that have chronic health issues is when they have multiple infections layered up and they get their stool test back or their infectious panel back and they find there's 1 or 2 infections. We treat those infections, they come back negative, but a new one comes back. And that's a really frustrating thing that I let my patients know, that there's probably a 20% chance that may happen. And we call it, I refer to it as crypt hyperplasia, where the infection burrows deeper into the gut lining and makes its way out as we kind of clean through all the crud, if you will. What's your take on it? How do you explain that or educate your patients about that?
There's a couple different analogies that I use for that. One is that, we're basically going after the bad guys that we see in the beginning of the forest.
Yeah.
But not the ones that are deeper in.
Deeper in, right.
And so you have to kind of keep retesting for that. And then, of course, I'll get a little technical with them and talk to them about biofilms and how biofilms can get, resistant to things like oil of oregano and, that kind of thing. So you kind of have to play around with some of these agents that we use to get rid of this stuff, to actually get after it. And then, the other part, too, is that if they've done a lot of antibiotics, traditional antibiotics, or they've done a lot of use of these herbal antibiotics, oftentimes what doesn't come into play is the repopulation of the gut. And so basically we leave this like 5-star resort open with neon signs that says, bad guys move in here. And then they're easy to pick up on something else. So sometimes they pick up something else through their travels or whatever, but sometimes it's just really just uncovering it and exploring deeper in that forest.
And this is helpful because I think a lot of people, they expect, let's say they have a couple of infections, they expect that once those infections are gone, that they're going to feel 100% better. And in your situation, what percent better were you after those first 2 infections, the H. pylori and the crypto?
At that point, we had done a lot of the diet lifestyle stuff.
Yeah.
So I would say 60%, but getting rid of those only got me about another 10%.
And then, so
It
was that
wasn't
last one?
it wasn't until we found the Giardia and
Yep.
start treating the Giardia that things really started to fall into place. And then looking at my final lingering symptoms, those are all Epstein-Barr related.
Mm-hmm.
And so now that's my focus personally. Like I still work on this stuff. I've been working on this since 2009, so it's some of my clients are like, when does it ever stop? And it could stop now, but I refuse to accept mediocrity. And, I want to feel good all the time. So I will always pursue it. But some people choose to stop when they feel 80, 90% better.
Right. And I guess it depends, right? Because everyone, when do you stop eating healthy? When do you stop exercising? When do you stop getting good sleep, right? It's very easy to get addicted to feeling great. And then the potential of, hey, can I feel 5% better this year? What do you think? Is that possible? So it kind of gets exciting, right?
It totally gets exciting. And, the thing is that things will change. You'll start to feel better. And then you'll decide that you want to go travel to Nicaragua and you get a really nasty bout of food poisoning. Well, guess what? You probably just picked up something that you should test for and see if it's still hanging out in your gut after you get back. So, we pick up stuff like this all the time.
And what are you doing right now for biofilms? You brought that up earlier with antibiotic resistance, people taking it in the past. What are you doing for that with your patients?
Biofilms, you can use several different agents. I like to use Interphase. There's a couple other things that I've used in the past. Not Biotagen, that is a prebiotic powder.
Yeah.
It's the Biobotanical Industries. Do you know which one I'm talking about?
Well, there's a couple out there. The big ones that I know for my biofilms are ginger.
Yeah.
Silver and cat's claw or cemento. Those are some of my favorites to use for the biofilms. Ginger tea is like mandatory for all patients to sip on, for the first few weeks, because ginger's a lot of studies on it helping biofilm reduction.
Oh, that's fantastic. Yeah. Biocidin is the other one that I've used. Yep. And that seems to do a really good job with people who have been on the Interphase for too long. And then all of a sudden you've got something that's resistant to that. But ginger is new for me. That's really fascinating. I'd love to see those papers.
Yeah. You just go ginger and biofilms. There's dozens of them.
Excellent.
There was one cool paper where it showed like a petri dish of like all this resistant bacteria with biofilms. And then like they introduced a small bit of ginger to it and it was like gone. So a big fan of juicing. I'm a big fan of juicing it though, like fresh juiced ginger, like just kind of throw it in your Vitamix or Magic Bullet. If you don't like the pulp, which I don't like the pulp, I strain it through a French press and there you go. Add a teaspoon of honey, especially if you don't have any fungal issues, you could do it. A quarter of a lime and you're good to go. And it really helps reduce those biofilms.
Yeah, ginger is amazing stuff because not only do you have biofilm disruptor, but you've got some really great probiotics that are on the ginger root itself.
Yeah.
So yeah, pretty amazing stuff. I like it.
Yeah. Also anti-inflammatory and anticoagulant. So it keeps the crud that gets, stuck or sludgy moving along, right?
Yep, absolutely.
Cool. So with your patients right now, would you say the most common autoimmune condition you're seeing is Hashimoto's or thyroid autoimmune disease?
Honestly, I don't see a lot of Hashimoto's clients. I just see autoimmune diseases.
In general.
They're all over the place.
What are the big five for you?
Rheumatoid arthritis.
Yep.
Hashimoto's is definitely in there.
Mm-hmm.
But then I've gotten some really strange ones that, that are skin related.
Yeah. Scleroderma
the sclerodermas and those kinds of things.
Psoriasis.
Psoriasis for sure. Those are the big majors, really.
Yeah.
I don't see a lot of people with MS. And I don't see a lot of people with Crohn's. I thought I would. I had one client with Crohn's, but that was it.
Are you seeing a lot of multi-glandular autoimmune syndromes, like more than one autoimmune condition with the same patient?
Almost everybody I've known that's been diagnosed with autoimmune has been diagnosed with two, if not more.
Yeah.
I have two that I know about. I've had psoriasis in the past that's been healed, and I know that's autoimmune. It was never diagnosed by a medical professional, but I also have Raynaud's in the hands.
Yep.
That's fun. Yep.
I see that exact same pattern. Raynaud's, Hashis, and some type of either eczema or psoriatic skin condition is like super common.
Yeah, yeah, very common for them to go together.
And for listeners, Raynaud's is just a condition where you get these vasospasms typically in the extremity tips that can cut off blood flow and circulation, create that cold kind of feeling.
Yeah, it's pretty freaky when you look at your hands and your entire fingers are white
Yeah.
from the base of the fingers to the tips. The first day that happened to me, I kind of freaked out. I was on the bike and couldn't figure out how to get the blood flowing in the fingers again. It was kind of scary.
Yeah, I totally hear you. And then talk about the Epstein-Barr and I want to say mono or the chronic fatigue that tends to happen from that. How are you diagnosing? What are you looking at on lab work to pick up EBV?
So I'm a big proponent of the immunosciences panel. They've got a viral panel, and if you want, we can link to it in the show notes. But
Yeah.
They've got a really great comprehensive viral panel that you can run, or you can ask your doctor to run the markers for you if you want, which will take a look at whether or not you've got past exposure or current exposure. Most people who are dealing with chronic EBV have had a past exposure. And my theory is that our immune system is just not as strong at keeping it as at bay as somebody else. I mean, EBV is so common that we think that nearly 95 to 98% of the population has been exposed. It's just most of them can keep it at bay. So a lot of those types of symptoms are fatigue, feeling like you're getting the flu, but never really coming down with the flu, light sensitivity in the eyes, tinnitus in the ears, pain in the lymph nodes underneath the ears, those kinds of things. Maybe a mild fever, but hardly ever fever associated with it.
Yeah, that is super common. And the three major things I look at, I just pulled up the immunoscience panel, and that's exactly what I run. Viral capsid antigen, nuclear antigen, and early antigen. IgM and IgGs. Any IgM, that's a sign of more of an acute or potential active or reactive infection. Any IgG for the early antigen is a sign of a potential reactivation. Is that kind of what you go by too?
Exactly. Yeah. And, when I was first starting to look at this in myself, I did this with my naturopathic doctor and we ran the whole lab. And while I didn't have any IgM for active infection, I have had, in her opinion, the highest titers she's ever seen for IgG. So I got the gold star award for that. So it definitely tells me that that's something that my body's been dealing with for a very long time.
Absolutely. And what are you doing right now from a supplement or herbal standpoint with Epstein-Barr?
Yeah, so I am making sure that I stay as far away from sugar as I possibly can. Because sugar will break down L-lysine in the body, and L-lysine is the amino acid that we need to keep viruses at bay the most, which ironically, now that I know that information, is why after I eat a bunch of sugar, I feel like crap for 3 days afterwards.
Totally.
And I take L-lysine as a supplement. I've also been experimenting on myself, doing an N=1 experiment with using supplemental BHT. And some people don't like that approach. Some people love that approach. And that seems to be helping with the constant symptoms that I was having, and not as often anymore. Whether or not it's the BHT or the L-lysine, I don't know, because I'm testing two variables at once. But those are the two things that I've been doing. And then just really making sure that I don't have a lot of stress, because stress will set me back faster than anything.
I love how foundational things are right at your forefront. That's, I think, so important. I think a lot of people miss that.
I think we want to throw them in the back corner, to be honest, right? It's like we want the easy button sometimes. And sometimes the easy button is just making sure you're consistent with the foundations.
I see so many people that come in or have seen me before, other doctors, and they come in, they have a whole bunch of infections, and the doctors they previously were with just threw a whole bunch of things at them, didn't really get lifestyle changes dialed in, didn't really get the diet, didn't really get blood sugar, didn't really get the adrenals or any thyroid or hormone stuff, and they just went after the infections right away, and they just shut down. And I think, echoing on what you said, the lifestyle piece and the diet piece and even the hormone piece before that is so important as a foundation so you can go after these infections and not create a healing crisis.
Oh, absolutely. Like I see this quite often. And of course, everybody wants to end the pain. Like I get it. I totally get it.
Yeah.
And, we want those results right away. But I have seen clients do the same approach with other practitioners and, they get thrown a whole bunch of antimicrobials, for example, yet that practitioner didn't look at their liver function and didn't realize that their liver wasn't ready to process all those toxins that are created when we go after the microbes.
Yep.
And and they completely shut down. So that's why I do a bunch of labs up front so that I can see like, what's the status of the liver? What's the status of the neurotransmitters? Like, let's look everywhere and then figure out a strategy. And it does take time, for sure.
And you mentioned earlier the butylated hydroxytoluene, the BHT.
Yes.
Can you talk more about that?
So, butylated hydroxytoluene, which is a mouthful, BHT. Yep. That is the same BHT that used to be in breakfast cereal when you and I were young.
Yeah.
Like it's the same stuff.
Got it.
Yeah, it's the preservative. So there are...
It keeps it crunchy when it sits in the milk for a while,
that's
right?
Right.
Yes.
Totally. Captain
I know
Coach,
it is.
You bet.
Yes.
There's research out there that says that it's a neurotoxin. There's research out there that says it's not a neurotoxin. And as you know, when you read PubMed research, you are always going to find both sides of the picture.
Right.
But what they have found is that with lipid encapsulated viruses, so the herpes style type viruses, of which EBV is one, it's actually herpes simplex virus 4, that it has a really good ability to disrupt that lipid bilayer of the viral body and help keep the actual attack of that virus down. And so, there's a lot of research out there. There's a lot of anecdotal evidence out there that it works, which is why I decided to do an N=1 experiment on myself. And it seems to be definitely helping. Whether or not I want to do it long term, I'm not certain yet if I want to do it long term, but that's been the only negative of it.
I will put a link to the show notes. So anyone that wants to get more intel on that, they will have it at their fingertips. That's great.
Yeah, I'll also send you a link to include in the show notes. There's a PDF or an ebook out there called the BHT book, I think is what it's called. And it was written by a biochemist by the name of Stephen Folks. And he put together a bunch of the research on its effect on lipid encapsulated viruses.
I know, Steve. He wrote the book on smart drugs, right?
Yeah.
Yeah. Okay.
He is also known for, what is it? Aspartame? No, not aspartame. Araspartame?
Oh, yes. Yeah, the various racetams. Yep.
Yes, those. Yeah.
Big. Yeah, he's a big fan of those. Very cool.
Brilliant
Awesome.
Biochemist, though, and he really knows his stuff.
Yeah, I met Steve over at the, I think it's Smart Life Forum down in Silicon Valley over at Palo Alto. Yeah, he's a big guy over there, and he gives a lot of informative talks.
Yep. Really nice guy.
Very cool. Now, you kind of alluded to something earlier. I'm going to go back to it. My brain thinks it kind of scatters a little bit, but it'll all make sense at the end here. You talked about toxins and being able to check liver function. So are we talking about just like an ALT, AST liver enzymes on a blood test? Or are we talking about organic acid testing for the liver?
I use both. I want to take a look at both. So when I take on a client, we do a full blood chemistry workup and an organic acids, and I'll look at both. I want to make sure that both phase 1 and phase 2 processes are functioning properly. If they're not, then I probably won't go after microbials or pathogens or environmental toxins right away, because we want to make sure that the body has an appropriate way of clearing this stuff. We don't want to just add a whole bunch of extra burden to the liver if we can help it.
And what's your cutoff for the ALT and AST on your lab test? Less than 20?
Pretty much, yeah. I want to make sure that it's not too high. We want to make sure that it's working efficiently. So yeah,
that's exactly what I do. Now let's pivot here. You mentioned in our pre-interview, you talked all about the organic acids. You talked about, and I love the organic acid tests. I know I do the Genova testing in my office. I know you mentioned you do the GPL, the Great Plain Lab testing, and you
Yeah.
also mentioned about their tox screen, which I've doing more and more frequently. I'm actually going to be doing a panel on myself as well as the one for the Roundup, the glyphosate
Oh,
too.
yeah. Yeah,
So
definitely.
so let's pivot there. Talk to me more about the organics and how you're using it with your patients, and then kind of stack on how you're interchangeably using the toxic screen too.
Yeah, sure. So, organic acids, I was taught by another practitioner how to interpret organic acids, and I've used the Genova as well as the Great Plains. And
Hmm.
the thing that I love about the organic acids is we're looking at metabolites of various different biochemical processes. And
Right.
when there's a problem with one chemical changing form to another chemical in that cycle,
Yeah.
it'll kind of spill over. Just like if we had dammed up a reservoir, it kind of spills over and it gets into the urine. And this is how we can see where there are problems in those functions in the body. And I think I love it so much because it's one simple collection for the client.
Yep.
And there are so many different markers that look at so many different areas. So we can see bacterial overgrowth in the body pretty easily. It's super, super sensitive for yeast. Whereas in any kind of stool test, like if you find yeast, then you know you've got a raging yeast infection.
Absolutely.
Yeah, so I like that it's super sensitive for yeast. You can look at neurotransmitter balance. You can look
Yep.
at methylation, nutritional deficiencies. Like there's so much information in the organic acids that it just
Mitochondria.
really, mitochondrial function, which is huge for
Mhm.
people with autoimmunity. Like, of course, you're feeling fatigued because your
Huge.
mitochondria are not generating energy the way that they should. And they're the energy powerhouses of the cell. So, knowing that allows me to be able to fine tune somebody's wellness plan so that they can start feeling better sooner in looking at those kinds of things. So I love the organic acids for that reason.
What major areas of the organic acid test are you seeing out of balance in your patients right now?
Oh, gosh.
And I mean, just myself, I see them all,
Yeah.
but there are certain ones I see more frequently. I'm just curious, just kind of like just your intuitive guess.
In the last year, there's been a
Yeah.
lot of oxalate and yeast issues.
Mhm.
I've seen not so much neurotransmitter imbalance, but definitely mitochondrial malfunction.
Got it.
And then the rest is the bacterial overgrowth.
Yeah, it's really nice because it gives you that extra net to pick up gut issues outside of what you may miss on a stool test.
Exactly. Which is, we were talking about that forest, right?
Yeah.
And trying to find the bad guys in the forest. This gives us another way to do that with a different method, which makes it a much better sweep of that forest.
Totally.
Yep.
And what about the tox screen? What kind of toxins are you seeing? How much Roundup? How much benzene, toluene, whatever else we're seeing there?
Yeah, I really like it. I mean, there's 172 markers on the lab, so
Unreal.
it's pretty comprehensive. But that is allowing us to not only look at what somebody is biologically infected with, like a co-infection, but the environmental toxins from everywhere. So if you are getting exposed to lots of gasoline or gasoline exhaust fumes, for example, maybe your work is, maybe you're the person that holds the construction sign on the highway, and you're breathing in fumes all day long, or you're a dental hygienist and you're being put in the face of chemicals all day long. Like, we get to see those things, but more importantly, we're seeing pesticides that are used either in the yard or in a garden. We're seeing the chemicals that are used for cleaning in the house, or insecticides right in the house, and cosmetics. I have to say,
Yeah.
cosmetics and self-care products, the shampoos and the soaps and all of that stuff that we put on our skin shows up in this test. So I really love it because this is what hammers down the lifestyle piece of it, right? Making those changes to make sure that you're not getting exposed to plastics, for
Yeah.
example. Yeah.
And what are the top 3 toxins you're seeing come back in that screening?
Honestly, they're all over the map. I've just started running it, and it seems to be a little bit different for everybody. So I haven't seen something that's very common. Now, the glyphosate that you had mentioned,
Yes. The Roundup. Mm-hmm.
Yeah, so that's pretty much coming back on almost everybody.
No, it's scary. It really is scary.
Yep. And that one, not only is it Roundup, but that's, people hear about GMO versus organic food. GMO, 9 times out of 10, is a plant that has been modified to be able to be Roundup ready or Roundup resistant.
Exactly.
Right. So they're spraying it. Like, this is the whole deal with GMOs. It's like they're spraying it with pesticide, folks, and you're eating it. Like, that's
Tons.
what's happening.
Like billions of pounds a year. I just got my whole lawn in my yard here in Austin replaced, and we put down sod. And before they were saying, oh, well, typically the protocol is, we're going to throw down a whole bunch of Roundup. I said, nope, you're just going to, go and scalp it, use the bulldozer or whatever, do what you got to do, no Roundup. They said, oh, everyone does it. It's innocuous. It, turns into a salt, goes away. But I'm seeing exactly what you're seeing. Lots of glyphosate or Roundup is found in people's urine. So it's obviously getting extracted or it's coming out. But the question is, I'm not eating or, pesticides and things like that. How are we getting exposed to it? So it's got to be ubiquitous in the environment.
It is pretty ubiquitous. And I've talked to the folks at Great Plains, and they're seeing it in almost 100% of samples.
Scary.
It is really scary.
Yeah.
And thank you for putting in sod and not turf.
Yes.
Thank you.
You got it.
Yeah.
Try to be.
Because I can only imagine the amount of plastic chemicals that I'm going to find in somebody's tox screen. Then they tell me that they have a turf lawn.
I know. And I called up the people over down here at Chem Free Lawns in Austin, and I was talking to them about chemical-free fertilizers. They use a lot of probiotics, or they'll use natural herbs, or they'll even use various helminth or worms to kill various infections.
Cool.
And we were chatting about that for a bit, and they were talking to me about the demand to switch away from these more carcinogenic conventional pesticides to these more natural ones, how it's just the demand is out of this world. And I think people are catching on. If you follow the Truth About Cancer series that was out again this last month, a lot of these chemicals are associated with various lymphomas and leukemias and cancers and are carcinogenic and hormone disruptors. So I think it's great that people are, by and large, are starting to get exposed to this information.
Yeah, absolutely. And it's one of those things that can contribute to autoimmunity.
Huge.
Because, it's huge. So it's super important.
Well, is there anything you want to just kind of leave us with here? I'm going to go into my last question that I ask every guest. But is there anything else you wanted to share with the listeners that you find just really impactful or you're just really passionate about right now that you want to share?
Yeah, I think one of the things that I've found in my practice that has been extremely powerful is not only is it diet, lifestyle factors, looking at the functional medicine piece of it, but it's also really taking a look at your life and what's important and sorting through what matters the most. And once you identify what matters the most, like, get rid of everything else that doesn't, because it's just added stress and we don't need it. Right. So really kind of becoming clear with that. And I think a lot of times people feel like they are expected to have this career, be the perfect wife, all of those things. And it's been really fascinating to determine that sometimes I end up counseling people through career changes and relationship changes. Like, those are really key parts of health. So don't ignore the emotional side either. That's my point.
I think that's really important. Where can our listeners find out more about you?
So they can go to my website, which is torearodriguez.com. We'll include that in the show notes because that's a handful to spell out.
And that's only one R, Torea Rodriguez.com. We'll put the link
Correct.
there below. Anywhere else? Do you have a YouTube channel? Do you have a podcast? Do you have anything else going on?
If they subscribe to my newsletter and blog, I do a video blog every week. So they'll be able to get that in the newsletter. And then the other thing that I'm working on right now is a 5-week course that's going to launch in January. That's an environmental toxin course. So it's 5 weeks to help clean out the home and the body without getting overwhelmed. And that's going to include that environmental tox screen that we talked about.
Love it. I'm doing that more and more. I got one on my test sitting on my desk here that I got to get done soon on myself. So I'm excited.
Excellent.
So last question. If you're stuck on a desert island and you only could bring one supplement with you, what would it be?
Supplement.
It could be like an herb. It could be like coconut oil. It could be like anything. Just supplement or compound or tincture or whatever you want.
Well, the first thing that came to mind is what I'm going to go with. I'm going to say an avocado tree.
An avocado tree. There you go.
Yeah.
Okay, so essential fatty acids.
Essential fatty acids, lots of fiber. It's it's awesome. So I love avocado. That would definitely be it.
Got it. Getting our monosaccharide fats going. Very cool. Yeah. And also, fun fact about an avocado: avocados have more potassium than bananas. Everyone thinks, potassium, like crabs, right? Grab a banana. Well, actually, avocados have more and less sugar.
Avocados, awesome.
Very cool. Awesome, Torea. Great chatting with you. And we'll look forward to have you back on the show soon.
Yeah, thank you so much. Super fun.
Thanks. Take care.
Got a question for Dr. J? Go to BeyondWellnessRadio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to BeyondWellnessRadio.com.